So thank you, everyone. Welcome to this session, which is Getting Real, Australian Ways of Civil Preparedness. And we'll be bringing together a series of experts and security practitioners and civil society voices to discuss the evolution of the Australian way of civil preparedness, drawing on the experiences of the panel and the current foundations that we have for preparing for shocks and emergencies. Of course, preparedness may have been a word that many were not thinking about necessarily in the community in this way prior to the 28th of February, but certainly very topical now. Of course, there will be ongoing activities within government around that, and we'll just work around those issues depending on people's questions. So we have to my left here Major General Jason Walk. Major General Walk is the head national support in the Department of Defence, with extensive service across tactical, operational and strategic appointments, including command roles in logistics and movement control. He brings significant experience shaped through his senior defence leadership positions and international deployments. He is extremely busy at the moment, and we are very grateful for him to be able to take just a tad of time out to be with us today. Next we have Joe Buffone, PSM. Joe is the Managing Director of Strategic Crisis Solutions Proprietary Limited and former Deputy Coordinator General for the National Emergency Management Agency. Probably the most famous person on the panel here, as he often appeared in the background of a whole range of, emergency supporting the government of the day in terms of the crisis management, in particular through terrible floods that I worked with Joe with and the bushfires prior to that. So he has more than 40 years of senior leadership experience in security, disaster management and national crisis coordination, and he's the conceptual architect of the current national coordination mechanism, author of the Crisis Appreciation Strategic Planning Doctrine and an accredited Level 3 incident controller and a leader with extensive operational experience across major Australian and international emergencies. I have Dr. Atul Sharma. Dr. Atul Sharma is a medical doctor in southwest Sydney and a co-joint associate lecturer with the University of New South Wales School of Medicine. He's currently working as a psychiatry registrar in a mental health intensive care unit, and that must be an incredibly challenging and interesting experience all at once. He contributes his experience from clinical practice in parliamentary advisory work and democratic engagement and leadership. And I also have Dr. Dominic Meagher. Dr. Dominic Meagher is an economist and public policy specialist at the Australian National University, where he is a research fellow at the Centre for Climate and Energy Policy and a non-resident fellow at the John Curtin Research Centre. Dominic works across climate and energy policy, geopolitics, China economic impacts and the transition to a post-carbon industrial economy, combining academic research with applied policy roles in Australia, China and the Reserve Bank of Australia. So I think we have some talent up here at the front of the room. I know we have some talent in the audience as well to shape some interesting questions. So I'm going to hand over to Jason to give us some remarks related to his experience in preparedness. So over to you, Jason. Thank you.
Rebecca, thank you. Perhaps useful to start with a description of the role that I perform. So I head up a relatively new organisation, National Support Division, inside the Department of Defence, and our genesis comes, in fact, from our inaugural National Defence Strategy, which introduced a concept of national defence. National defence talks about whole of government, indeed whole of nation response to deep crisis and indeed conflict. And the work that we are doing is to understand our preparedness requirements, what defence would seek to draw upon from the nation to be able to respond to crisis. And I guess the frame of reference that I'd offer to you is, as we had to do with the Vietnam conflict, where we sought to move beyond our force in being, as we had to do in response to World War I, World War II, that planning, that mobilisation planning that was undertaken, that is the work being undertaken by my organisation. We have some great foundations inside defence in terms of our planning in relation to preparedness, Preparedness is a part of our DNA, if you will, in terms of how we undertake our understanding of risk, of how we focus defence capability and force design and development. What is relatively new for my organisation is how we apply our preparedness lens to that whole of government and whole of nation approach. And that has been some fascinating work that we've been undertaking in terms of gaining a deeper appreciation of national preparedness and how national preparedness and indeed resilience supports a defence response to a national crisis or conflict, if you will, arguably the worst today or epoch in a nation's life, response to conflict, how well we are prepared to be able to draw upon all of those instruments of power that are available to a nation, to a government to support that defence and a national security response to deep crisis and conflict. So some very important work that we've been doing, and I emphasise not doing so in isolation, but doing so dealing with other Commonwealth departments and colleagues, other state and territory jurisdictions, and I was fascinated in the session that we heard earlier today, as well as starting our engagement with local governments as well, but also engaging with industry and society as we start to develop our appreciation of national preparedness.
I would just ask one question. In all of that, as we have moved from, the templates that we've had from past decades and past eras, as you look forward now, what's the sort of one thing that would help most to you in your role as you work to have a plan about how we can draw on all of our national assets should we actually need to? You can have two things.
I was about to say one thing is a really hard question,
Okay.
Rebecca. So two things. Perhaps I'd start with an appreciation of how we might undertake coordination in times of crisis and conflict. We have some great work, and I note the gentleman to my left was not incidental in contributing to this, but our government national crisis management framework is a wonderful starting point, but seeking to determine how we would evolve that framework to enable that whole of government, whole of nation response to a conflict which might, for example, see far more government engagement in things such as the economy, in guiding how a nation would respond. That is one area that I think requires substantial work. And then I guess, coherent response to how we build our national preparedness, which has contribution from all facets of society, industry and government. That would be the second that I would be in deep appreciation of.
Excellent. Thank you. And, I think we have seen in the consultation report this idea that we talk about security, but really it's about safety and therefore people being prepared. So this is very much a relevant topic. I might move now to Dominic to see what you'd like to contribute in this conversation. Thank you.
Sure, thanks. So my current work is on in the Climate Centre, Centre for Climate and Energy Policy, is on green steel, decarbonising green steel and the geopolitics around that. But what I really want to talk to you all about today is some of the work that we've really just started hearing about. I grew up in Wollongong, and in '98, my dad's car was washed down the street in a flood with him in it. He had to climb out the window and hang onto a branch tree. The car got written off. In 2001, we had the Black Christmas bushfires, raining cinders from the sky. We had gum tree leaves coming down, glowing into the backyard, confusing the hell out of my grandmother, I've got to say. In 2020, the fires on New Year's Eve, my cousins were in rural Victoria, where they live, and watching those updates as the new year ticked over, and all anyone wanted to know about was what's happening with the fires, not what's happening with the fireworks. It feels shocking every time this happens, But with climate change, it's happening more and more often, more and more intensely. And we really can't ignore this story that the climate scientists are telling us anymore. So this idea of once in a generation is starting to feel like almost an annual event. And the first thing that happens every time there's a flood or a fire or some other disaster is people say, where's the ADF? Right? This has become the only capability that we have. It's a very bad national habit that we've created. The ADF has a job to do. And this isn't, they show up, they help, they evacuate people, they help with sandbags, they move supplies, they've got logistics sorted, they're incredible at logistics, they save a lot of lives, and I think it helps building community relations for them. People trust it, that's great, it matters. But it's not their mission. It's distracting them from their mission. It would be better if we had a civilian system for doing this. So we have volunteer firefighters. We have many civilian systems, frankly, but they're stretched way beyond what they're designed for. So, where am I going? What we've proposed is based on the economics of responding to climate disasters like this. What you need in this kind of situation is a sudden surge of people, a lot of people, with some fairly basic skills, some fairly basic training and equipment, machinery, and logistics. Right? You need to know who they are before you get there because there's insurance issues. There's all sorts of reasons that this has to be coordinated properly. But you don't need a degree in filling sandbags. Right? You need a few days or maybe a few weeks of training. I was speaking with the Finnish colonel earlier this morning. They have their whole of country approach to national security, and they give people, everyone takes 4 weeks a year of training. We've been looking at 3 weeks for a volunteer version of this, modeled on the Army Reserves and costed on the Army Reserves. And the idea would be that anyone who wants to step up and take the training would get paid to do training in basic skills and be part of the organizational structure that means they could be called up when they're needed. So this is a sort of proposal that we've been pushing through the John Curtin Research Centre. It would be collaborative with all the existing institutions. There's a lot of people who are already involved in this. We're not proposing to tread on everyone's toes. There's a lot of people that are doing great stuff, and the idea here is to add to that in a way that makes it easier for them to do their work rather than take away from the work that they're already doing. So the first part of it is getting these people in place in an emergency in advance. But as I said before, you need the people with the skills, also the equipment and the machinery. So the second part of it is really a industrial policy. And this also is relevant to other parts of national security. If you're flying helicopters to put out fires, if you're flying drones to find fires, if you're building trucks for fire trucks, in 2020 we saw amphibious evacuations of people from fires at a beach. This is military equipment. The industry that builds this stuff is the same industry that supplies the Defence Force. If you're building twice as much or you're buying twice as many helicopters, you can underwrite the industry more economically. So there's a big complementarity in terms of making the defence budget stretch further and being more prepared to deal with disasters. So it goes from everything from those machines I mentioned all the way down to uniforms. So the question around, is this realistic? What we've done is costed it along, or partially costed, I would have to say, aligned with how the Army Reserves work. They get paid about $209 a day for 21 days of training a year. We proposed aiming for 200,000 people to be trained over the first 5 years of a program. That'd be 40,000 people a year, which is about a fifth of the annual Year 12 graduating cohort. Not that we would say it has to be year 12 graduates. This is a volunteer kind of a process because it's Australia. But if you're looking at 40,000 people, that's sort of benchmarked how many we're talking about. And over 5 years, 40,000 people a year adds up to 200,000. In the 5th year, it would be costing $1 billion in training for 200,000 people to get annual training. So the people who are trained in the 1st year would get trained every year, 3 weeks a year. And by the 5th year, you'd be training 200,000 people. So that's $1 billion. It's not a small amount of money, but it means that what are you avoiding? You're avoiding the food price inflation when floods come through farms. Right? You're not producing farms, the food price go up. You're avoiding the house insurance inflation. Right? It's been said earlier today that Lismore houses still haven't been rebuilt. If you can draw on 50,000 people to go and help out, that'll get done much faster. So this is the kind of logic of what we're trying to push with preparedness. The other part of this is that if you're stepping up a major training program for climate disasters, you can share that with the region. Right? The Pacific Islands, they need a lot of this kind of stuff. It's their biggest national security fear. They don't have the capability to do everything. But if we've got a training system and an industry that can provide all this kind of thing, it's much easier to help them. And probably in Southeast Asia, similar story. There's a lot of diplomatic gains like that. For unions, it looks like a sort of small version of a jobs guarantee, which they love, because anyone who steps forward to do the training gets paid. There's a lot of ways that this benefits. So when we look up at Darwin right now, and there's floods again, and the ADF are again there, and everyone's very grateful for that. The ADF are pretty stretched right now. There's a lot going on in the world. It would probably be better if civilians could manage that part of this problem, and the Defence Force could get on with their mission. And that's the thing that we've been proposing.
Thanks, Dominic. I'm interested in the extent to which, in that work that you've been doing, you've also contemplated that if you had 50,000 people a year being trained in cohorts, the way in which that could further contribute to cohesion. One of the things we see in the ADF is the sense of camaraderie, which is deep in their DNA because they start their ADF training together. I'm interested in those aspects and the aspects to which, in terms of the costing versus the economic benefit modelling, I'd be interested if you expand on any of those points.
Yeah, absolutely. We did consider that. One thing that's happened in Australia is that independent schools and religious schools have sort of helped stratify us into little cohorts and that don't have a lot of, let's say, cross-pollination. This is the kind of thing where it brings people together outside of their normal social circles, right? It helps people network up and down the income ladder in different suburbs, right? It brings people together and forms community. It's also the kind of thing that new arrivals, new Australians can get into straight away and really sort of prove their commitment to the country, which, I'm not saying that they need to, but often that's something that they look for. And on the economic side of things, I think the cost of climate change exists already because of the climate changing, right? That's the source of the cost. How quickly we deal with it, whether we take it on head on, that's the cheapest way of handling that cost. If we stand back and hope that it doesn't happen, then how we deal with it will be the last option available when we're forced to make a call, and that'll be the most expensive option.
Yeah. Thanks, Dominic. Ashal.
So thanks for the introduction, and it's great to be here. So when healthcare systems are undermined and when individuals with healthcare needs fall outside those systems, the effects extend far beyond clinical outcomes. They weaken community preparedness, they erode social cohesion, and will have direct national security consequences. Healthcare is not just a service, it is a critical infrastructure. Our delivery systems, workforce, critical databases, and rapid research development will all evolve alongside national preparedness, and I would argue contribute directly to the capability and capacity of our defence and national security sectors in times of disasters. So the findings from the National Security College Consultation Initiative are very insightful, and I'll structure my remarks based on it. But I also want to extend that conversation, particularly in relation to misinformation and increasingly AI-generated misinformation in healthcare that can be manipulated in times of crisis. This is what I consider a gateway to broader disinformation, and I'll frame this challenge as one of mental health preparedness. Alongside this, we are facing an evolving threat multiplier in climate change and risks to critical supply chains in healthcare, impacting coordination and response. It's not only one shock we have to prepare for, but multiple shocks at the same time. So I should say I don't represent an organization, and I'm speaking as a junior psychiatry registrar working in a mental health intensive care unit, caring for people with severe mental illness as part of the Mental Health Act. But I would argue that particularly in the wake of COVID, that public health and national security can no longer be seen as separate domains divided along usually political ideologies. They're deeply interconnected, operating across all levels of government and sectors, and they must be working together if we're to meaningfully strengthen social cohesion and preparedness as threats evolve. So the first topic I want to talk about is based on the report that showed that roughly 3 in 4 Australians believe the most serious risks include the threat of AI to attack Australians, misinformation and disinformation, and foreign interference. I want to frame these risks through one issue, and that's healthcare misinformation that undermines trust in democratic institutions, that makes us more vulnerable when crises strike. To start off with, hospitals and clinics are public institutions. At a geographic level, healthcare is almost always in the top expenditures, so it's a significant public institution. And at a fundamental level, to have a healthy democracy and social cohesion requires a healthy population. So healthcare workers consistently rate as the most trusted professions in society. So what happens when that trust erodes in healthcare and that distrust is targeted to broader institutions? I want to use the US health debate during COVID as an example. Anthony Fauci, the trusted voice and evidence base for the medical profession during the pandemic, provided such a strong evidence base and response for uncertainty in decision-making. However, lots of people didn't trust him due to external factors out of his control, and it translated to blunting trust with other key stakeholders, including health departments, hospitals, the quote-unquote government, and sometimes their own doctors and circles. Now, why is that bad? Well, I refer to the Elderman Trust Barometers, which have a yearly specific report looking at trust in healthcare. It demonstrated that if people don't have access to their doctor or a leader, or, religious leader, whatever you call it, but particularly their doctor, 65% of Australians turn to online searches, social media, and friends and family, while only 41% use health websites, institutional websites, or NGOs. That's a near 25% gap that favors away from evidence-based misinformation. Furthermore, 1 in 2 Australians believe that taking better care of self is not a high priority in their life right now, and this is incongruent with our evolving healthcare system, which is composed of an aging population and those with chronic care needs, whereby health is one of the key priorities in their life. So when disaster strikes and those people attend the hospitals, who are the rest of people who attend those hospitals? When we are in online spaces that are increasingly being polluted for secondary gain, I wonder what population groups those gaps fill that are not captured by major healthcare systems and are particularly vulnerable to misinformation. For example, people who don't usually visit established healthcare spaces, such as usually young, mostly physically healthy people, men like me. So Australia needs to be aware of this, particularly as we are setting up our own Australian CDC. So Johns Hopkins University, one of the world's best medical institutions, released a report proposing a national strategy to combat misinformation and was going so far to say that we need a, quote, multi-agency national security effort that prioritizes management of public health disinformation from both domestic and international sources as a national security issue. Should we heed their warning? So we know that healthcare misinformation can lead to institutional distrust, and I believe that that can be a precipitant when conflicts or when disasters strike. And I want to talk about other secondary gains of misinformation in the age of AI. So these secondary gains that put profit of people's harm at the expense of their health includes financial gain and foreign interference that leads to broader issues in social cohesion and community preparedness that I believe have national security implications and requires a whole-of-nation approach when the disasters happen. The first one that's becoming quite topical, and I think that's the manosphere that I really want to briefly talk about. Broadly speaking, the manosphere originates in issues in mental health, particularly young single men, manifesting in unhealthy displacements, including misogynistic views and political extremism, incongruent to democratic resilience. This is now brought into involvement of national security and law enforcement agencies, and is perpetuated by an environment where there is financial gain of the key influencers and agencies that prioritize engagement on their platforms. This ecosystem perpetuates further mental health decline and will further predispose and at times precipitate evolving risks in our social cohesion. Now, the second example is one the WHO is calling infodemics, which is particularly relevant when it comes to climate change-related disasters. So infodemics is false misinformation during a disease outbreak, intentionally causing mistrust that undermines public health responses. We have reports of infodemics that are being used for secondary gain in the context of foreign interference. We now have reports that an ally country, during the global vaccine rollout, purposely created an infodemic in an Asian country to undermine rival countries' vaccine and stifle their rollout of a vaccine. As if the impacts on that affected Asian country does not directly impact diaspora communities here in Australia and undermine our public health responses when the crisis strikes. And it doesn't necessarily need to be during a health crisis in the context of a pandemic or climate change. We know that Russia in the 2016 election was using vaccine skepticism to create false equivalency to wedge division through bots on social media. It's arguable that that was responsible for the 2016 election. It probably wasn't. But the seeds were sowed for political division when the pandemic started. And now, 10 years later, critical research in precision medicine that could have saved countless lives, to be honest, prevent millions of lives from dying, is starting to be gutted and has somehow entered mainstream discourse outside health domains. We're now 10 years on from these simplistic bots in the age of AI that knows a lot more about influencing us. Now imagine if the critical data that was used to feed these models, 9.7 million Medibank customers, 12.9 million Medisecure scripts, the most recent one, the hack on US biotech firm Stryker this month by Iran, totaling 50 terabytes, including Australian data. I wonder if AI can train on these data banks to generate healthcare misinformation to sway specific Australian views longitudinally. When one thinks of their health, it does not require an external event like elections or flashpoints or climate change, but they can be sort of at the ready if it does happen. I wonder if the age of precision medicine correlates with the age of precision disinformation. So the NSC report looks at views of national security and the issues combined with foreign interference, misinformation, and direct impacts on social cohesion. So the conclusion from my perspective is that these stem from a complex anxiety with lots of secondary gain that is less amenable to traditional leaderships at time of crisis. And it can be framed as, in the language of epidemiology, a commercial determinant of health with national security implications. And by framing it in epidemiology, we can address the underlying causes and treat the symptoms through a systematic and community-centered approach. So the second thing I want to talk about briefly is about healthcare preparedness in the traditional senses, so disaster scenarios, where the community initiatives also went into as well. So healthcare delivery is critical in all of the phases of the crisis continuum. Generally, the main thing I mentioned is that for the crisis situation itself, having a deployable healthcare workforce would further stretch civilian or state systems in an already sort of critical workforce. And I can say that from my experience working as a doctor in public systems where there is a shortage of doctors everywhere. So where are they going to go in times of crisis? The first topic I'll briefly go into is climate change. So we know extreme weather events are becoming more intense and frequent. There's a lot more sort of unknowns in clinical medicine, and Australia is one of the least climate resilient countries in the world. We're also one where health equity to rural and remote populations will be further undermined if climate change is not addressed. And secondly, I just want to give a shout out to Australia for rapidly enabling clinical research trials that can be used in disasters to enable us to understand a bit more about addressing healthcare issues. And the second I'll talk about is just disaster management healthcare technology in critical supply chains. So for example, during the Bondi attacks, the hospitals that managed those patients still uses paper notes, while surrounding hospitals use electronic systems. And an international one is the US biotech company Stryker that was attacked by the current Iranian regime that significantly impacted critical systems that put Australian officials on alert for our own hospital workflow. Now, I wonder if the threat multiplier of two crises, one planned and one unplanned, combined with this sort of precision disinformation can lead to severe disruptions in our healthcare. So overall, just a few take-home messages. healthcare and national security are not two separate domains, but have to be seen as linked to address community preparedness and social cohesion in a meaningful way. 2, misinformation in healthcare can blunt and has blunted trust in broader public institutions. 3, precision medicine correlates with precision disinformation that can lead to longitudinal threats. And lastly, disaster preparedness in healthcare can focus on key domains, including the workforce, that enhance the capability and capacity of national security responses.
Thanks, Atul. I'll not ask anything further at this point because I think those remarks generate quite a different set of thinking for us in the broader, just in the more traditional national security community. But certainly I'm sure the audience is going to have some questions about that. I might hand to Joe. Thank you.
Yeah, thanks very much. And first of all, can I acknowledge the work of the National Security College and ANU on the research it's done. I think it's a fantastic piece of work that can actually touch many, many different domains and disciplines, so not just the national security. So straight after lunch in a warm theatre, and we've got to keep you a little bit engaged. So I want to start with, we've heard a lot about civil preparedness, we've heard a lot around systems, we've heard a lot about surge capability. But if you think about it this way, when the infrastructure starts to denigrate, when formal governance systems start to be overwhelmed or also start to denigrate, when whole of society systems or formal systems start to denigrate, you know what's left standing? Civil society. Right? And it is the first responder. They are the ones that will always be the first responders, not the emergency services, not governments, none of those. It's the people that are front and centre that are actually dealing with it. And the research sort of shows that, because then what they're saying is we feel safe or understand the risks about what we experience directly. And what does that actually mean? So when we're actually moving forward and picking up on some of the points, everybody's chasing the dollar. The bottom line is that there are limited resources. There's 26 plus million Australians. We've got to make the most out of that. And I'm a big believer in leveraging off existing capabilities and existing systems. So having a surge model that can scale at speed and leveraging off existing capability. And we've actually seen that. So if you think about the threat environment, you've heard a lot about it and it's been played out. And I'm going to give you some other examples of it, so I'm not going to play them out. But the key thing is it's becoming more complex. We operate in a complex adaptive system, which means that we have to actually start thinking about systems theory. And I love the map of Australia of where the team actually went around, but that actually puts me in systems thinking around how the net, and Rebecca, you spoke about it, systems of systems, networks of networks, teams of teams. You can describe it in any way you like, but it's an interconnected ecosystem that has interdependencies and sometimes has unintended consequences. And what we're seeing is the polycrises that are more frequent, more intense, and we haven't even factored into deliberate attacks on some of those vulnerabilities. And I would argue that we've got more vulnerabilities that we've ever seen before. So the evolution of our, sort of capabilities in technology, in society, even our economic aspects, but our global interconnectivity is also some huge risks and some huge vulnerabilities. So how are we set up? We're set up now in, I would actually argue, some very sophisticated, but in some ways some siloed domains to deal with those threat vectors. We've got the defence system. Jason's sitting here, and it's great. Like, in previous lives, I've actually been a part of the Defence Force, does great work. It's trusted, and it's self-contained. You deploy it, give them a problem, they'll sort it somehow, right? They'll sort it. The other thing, interesting thing, when you look nationally, there's actually more emergency service police capabilities than the Defence Force, probably about 4 or 5-fold. Yet we keep leaning back on defence to say we need defence in there. But there are two critical domains that remain insufficiently integrated into national preparedness. That is the private sector and civil society. And I'm doing a fair bit of work in the private sector now, and I tell you, and I did a lot during COVID. I ran supply chain, everything during COVID. The private sector delivered outcomes faster, more efficiently than we could even dream of. They are incredibly powerful with the support of government to pull regulatory levers, policy levers, funding levers, the one that Rebecca spoke about, that help the system to continue. Limitations in our current system. Our current system is based on history, right? There's a reason why our windscreen is bigger than our rear vision mirror, right? You check in the rear vision mirror, but you want to go forward, and you want to go forward fast. And when you think about that, it's based on historical understanding of events. That's what we build our systems on. We build our resource model on that, and it's heavily enshrined in command and control. That's its premise in terms of how we run that. Except in polycrises, that starts to actually fail in many ways. And that's not being critical. At an operational level, you must have command and control. So I want to be clear. But at the strategic level, you need collaboration, you need coordination, and you need really sound communication, especially in the age that we're at. So what's the emerging paradigm? Novel and VUCA. So volatile, uncertain, complex and ambiguous. But that means that the systems need to shift from very rigid plans which are not flexible. So you have plans that are flexible, that can scale and actually deal with a whole lot of unknowns. You need to be able to deal with multiple shocks, and you need to understand that they have high stakes of life, liberty, property, livelihoods, elevated uncertainty, strong public emotion and limited capacity to scale at speed. So we need to be prepared to do that. And that is hard to do. Even some of the commercial systems, and I did a lot with supermarkets, they've got a system that is based on retail that cannot switch to a crisis mode. And we've had those conversations. But a couple of things I want to touch on. There's been some other recent studies that actually support these concepts. The UN Global Risk Report highlighted some really significant global risks that apply to Australia. Also, the NATO chief scientist just recently released an assessment on resilience, and there's some key conclusions there. Big ones, geopolitical risk, but mis and disinformation. So you've heard right throughout today, mis and disinformation is right up there. So how do we deal with that? The other thing is crisis environments increasingly involve multiple concurrent shocks rather than single hazard events. So the polycrisis is absolutely happening globally. And I reinforce, not necessarily taking into account the deliberate attack on vulnerabilities. And there are many scenarios that you can play out. Trust is now a strategic asset, and we've heard that being played out, with transparent communications a critical factor. And that's something that I think that we're challenged. Climate is immediate. So it's actually here with us now, and it's one of the most significant impacts. Cyber and AI related is both a positive amplifier, but also a significant risk. Strategic implication. Civil preparedness underpins deterrence, defence, crisis management and recovery, and is a strategic enabler. So that's a shift from hazard focus, threat vector focus to actually civil preparedness, I think is an important one. Critical infrastructure, supply chains, communications, we're seeing that right now. We saw it through COVID, the unintended consequences and the interdependencies. Rebecca, we were talking about just the chemical industry and just oil, the flow-on effect of polypipes that actually affects the housing industry that then flows on to some of the strategic policies that you're seeing. It goes on, and there's a number of other ones. I'm not going to touch on the report because you've heard that repeated many times. But what I do want to do is share with you 8 points that I think we should focus on and can make a difference. The first one is reset the strategic preparedness and resilience timeframes. We had a 10-year planning window, that's out the window. So we need to reset that and be able to think strategically in the short term though, not necessarily in a 10-year cycle. And the other thing is plan, plan, plan and plan, because we plan for the worst and then we hope that we never have to do it, and it's cost effective. Right, you can do it. You can have it there. You don't even have to invest in some of the infrastructure or resources. Because as soon as we go to planning, everybody goes, "I need more resources." Well, maybe you don't, because maybe you leverage on whole of society resources. The other one is I've spoken about the threat domains, but then the institutions that actually manage those threats. Now, we need to have that specialist capability, but I would actually argue that they need to know where there are thresholds or triggers where they intersect other domains that they traditionally do not engage with. So I spoke of, the national security is a closed shop by necessity, and you heard Duncan this morning speak about that. But also you can open that up at certain points so that, and we dealt with this during terrorism, where when, post-September 11, we had to look at CBR, emergency services, and they didn't have security clearances, they didn't understand what was needed, they had to open it up. Active engagement with civil society, and that make sure that the preparedness activities become agnostic. When you actually work them up, you might start in the defence area, you might start in national security, you can start in natural hazards, you can start in health, you can start in biosecurity, but eventually they actually move up, and you know what? They're actually threat agnostic. So if you were to matrix them, you would actually see that there's a whole lot of capabilities and preparedness activities that actually build resilience for any threat, for any hazard. The other one is really engage in building social capital. And I heard someone mention Daniel Aldrich, and there's a whole lot of work that's been done on a framework where you can actually measure it. But that social capital and social infrastructure becomes something that has legacy for a whole range of different threats. Open communication with the public, transparent about risks, preparedness, measures and residual vulnerabilities and plausible risks so that they can actually understand, and I think that the research shows that. And this is one that I think we can do, and we do it, but you know what? I'd actually argue that sometimes we do it in an echo chamber, and that is conduct regular low-cost simulations and exercises to test coordination and decision-making, but building understanding and trust across domains, including private sector and civil society. Quite often we exclude civil society. What we do is we practice it, which is really important because you need to build the relationships, you need to build trust. But you want to build trust? Bring civil society in and say, here are our limitations. This is what we can do. This is what we can't do. And I can tell you, I've personally sat in front of a community in a different life where I was actually petrified that I was going to, have rocks sort of thrown in, like stone him, because of the role that I was playing in the warning systems. When we explained what we can do, what we can't do, and the limitations, they understood it and they took it upon themselves to start preparing. And then the other one is reframe national security to include community resilience and social capacity as a core stabilising asset and not a peripheral consideration. Thanks.
Thanks, Joe. That's great. We'll hand to the audience shortly. A couple of thoughts from me in terms of one of the points you pulled out about the more the private sector can do, and I'll combine that with an idea of sometimes the point that the ADF are self-contained, give them a problem, they get it done, it's awesome. We also as a community lack imagination to ask anybody else to do it, and it tends to be a bit of a default setting. A small story from a million years ago, I was standing in the Joint Operation Control Centre. It had been raining a long time and there's bananas stuck up in Queensland somewhere, and the first call that happened was not to Toll Logistics or someone else's logistics system or whatever. It was to the ADF to ask how many banana boxes can fit in a Black Hawk helicopter. And the answer is not very many. And the rate of charge per hour of flying, huge. So, but it was really a lack of imagination. And during COVID, we had to build that workforce, enormous 20,000 extra people to help with all of the demands in Services Australia. 2,000 public service came and we had other people. Where did the rest of the people came from? We actually rang Qantas, we rang Virgin, we rang the travel agency system because those people were out of work, but they know how to deal with customers. So in many ways, we already have the tools in that sense. We just don't have sometimes the imagination to ask the right people to help us. Well, I hope that's been a session that's enabled you to keep awake after the great lunch break. I'd like to really thank my colleagues here on the panel. What a fascinating set of conversations, and really I'm going to speak for the three of us sitting up this end. A really interesting different perspectives we would not normally have access to in the national security the traditional security community. So I think it really makes the point that we need to diversify the conversations we're having, because there's a range of things that we need to bring together. So I'd like to thank the panel, and I'd also like to thank the fantastic audience participation and David and Isabel for running the last session. So thanks, everyone. I believe afternoon tea is next.